Welcome everyone. Today I will be your moderator. I'm Daniele Magalhaes. I'm the Senior Project Director at the Global Consortium on Climate and Health Education. So welcome to our session 7. Today we are going to discuss about climate change and mental health. As you already know, the session learner's objective is to discuss how natural disaster resulting from climate change impacts on mental health for a population, also to explore the impact of mental health of climate refugees, of those that have been displaced from their home or livelihood from climate-related environmental changes, and to describe what can be done to mitigate population mental health consequences, explore the unequal burden of climate change related to mental health disorders, and discuss strategies for targeted intervention in vulnerable population, including women, girls, and indigenous people. As you already know, the session has 90 minutes. We will have a lecture presentation at the beginning. We will set all the learning objectives. Then we will have 2 case studies. At the end, we will have a Q&A session. So please, if you have any questions to the presenters, including the Q&A session, you will find your Zoom toolbar. And the session will be recorded, and all the slide decks and materials will be available in our website. Just to remind you, the attendance will be automatically recording during the Zoom sessions. If you use your personal Zoom link, you are fine, and the YouTube views will not be counted as attendance. If you attend 7 or more sessions and pass in the final exam with a score higher than 70%, you will be granted a certificate. And the final exam will be in the last day of the course. It will be composed by 25 multiple choice or true or false questions, and you have to complete the exam in one sitting, because the system doesn't allow you to save and come back later. So be prepared for that. You probably will have until the next Sunday to complete, so make sure that you have time for that. And because when it's closed, we can't reopen the exam. So today we have these amazing presenters. Dr. Farzana Misha, Dr. Hashaam, Akhtar, and Dr. Maria Tika Kartika. Today we are going to start with Dr. Farzana Misha, who is a development economist with over 14 years of experience in impact evaluation, specializing in experimental and mixed method research with a focus on marginalized and climate vulnerable communities. She has worked with organizations such as BRAC and BRAC University, Save the Children Uganda, and the International Finance Corporation, and has contributed to both academic literature and policy. Dr. Farzana holds degrees in economics from Dakar University, the University of New South Wales, and a PhD from the ISS Erasmus University of Rotterdam. So, over to you, Dr. Farzana. Please, the floor is yours.
Thank you, Daniel. Hi, everyone. I'll just share my slides. Can you guys see it?
Yes, we can see it.
Yes. Excellent. Hi, everyone. This is Farzana Misha. I'm working as an associate professor at BRAC, James Brigand School of Public Health at BRAC University, Bangladesh, and also leading the Climate Change, Environment, and Health Hub within the school. Very glad to be here. So as you can see, today's session is on climate change and mental health. And today we will talk about how to navigate this emotional landscape. So first, to give you an overview, according to the Lancet Commission on Climate Change in 2009, climate change is the biggest global health threat. And according to the sixth assessment report from IPCC, it was mentioned that climate change is adversely affecting the mental health of population. So even few years ago, the intersectionality of climate change and health didn't gather much attention. But during the last few years, it did grab the attention, and it was recognized by IPCC and WHO. And during COP28 that took place in Dubai, there was a whole day dedicated to health, where we discussed how climate change is impacting human health, both physical and mental. It's been estimated that the mental health burden of climate change can reach over 47 billion USD per year by the year 2030, and which will be escalating even more, which is over 537 billion USD per year by the year 2050. Unfortunately, despite all these, only 3% out of 193 countries mention mental and psychosocial health in their NDC, which is nationally determined contribution. So how is climate change impacting mental health? So there is numerous evidence available, like how climate-related exposures, which includes heat, humidity, rainfall, drought, wildfires, and floods, are associated with psychological distress, worsened mental health, and higher mortality among people with pre-existing mental health conditions. And this can even contribute to new mental health conditions, increase psychiatric hospitalization, and heighten the risk of suicide. Apart from some physiological impact, climate change can also impact your mental health by destabilizing the condition needed for good mental health. For example, driving food and water insecurity, resulting in poor nutrition and ultimately impacting your physical and mental health, forced displacement or migration, and also disrupting access to treatment for mental health challenges in case you have pre-existing conditions. Also, lack of awareness of climate change and insufficient climate action. This can also lead to a range of psychological responses, such as climate distress. And during today's lecture, later we will talk about that as well. So now, as you can see in the diagram, it shows how different climate stresses can impact your mental health. On the left side, it's about communities that are directly experiencing different climate events. And on the left side, it's communities indirectly affected by climate impacts. So when you talk about, we talk about communities directly being impacted by climate events, is the communities that are experiencing high temperature, sea level rise, salinity intrusion, floods or fires, or chronic extreme climate events like droughts. So how does it impact your mental health? It can be through loss and damage of homes or property or assets. If you're a farmer, loss of crops and livestock. If you're experiencing a high temperature, physiologically, that will have some impact, ultimately impacting your mental health. Forced displacement or migration due to these events, which will also cause changes to your livelihood strategies. All these will impact your mental health. Either if you have pre-existing conditions, it will worsen them. It can give rise to new cases. There are evidence that it has also association with suicide. and also increased susceptibility to physical ill health or death for those with diagnosable mental health issues. But for communities that are not directly experiencing these, they can also suffer when it comes to mental health only by watching or seeing other communities being impacted by these events, and also hearing the news, which creates this emotion that if this can happen to other communities, this can happen to us as well, which eventually can also impact your mental and emotional well-being. So the relationship between climate events and mental health, it's not linear, it's quite complex. So I'll give you one example. So this is from a process diagram from Berry et al. So in my PPT, for each slide, I have provided the citation, the references where I took the information from. So here we only look at one climate event, that is drought. So as you can see in the green area, drought can result in decline agricultural production and crop failure, which can increase your workload. And also this can create employment and financial constraints, as a result, depressed economy. So all these can ultimately have some impact on your mental health. And during the process, as you can see, it's quite complex. For example, let's focus on the one at the bottom. So drought can result in environmental degradation of one's home, resulting in decreased availability and access to food, which will change your dietary pattern and result in missing meals, which is food insecurity. And as a result, you can experience anxiety. Similarly, for drought, when you lose employment, it can also cause stress, or it can cause identity loss, ultimately resulting in anxiety, or in a different way, it can result in domestic violence or gender-based violence also. Because of drought and employment loss, it can also result in humiliation and shame, resulting in depression. And when you experience anxiety or anxious symptoms, depression or depressive symptoms, if not treated on time, it can result in suicide as well. So if we want to categorize the mental health symptoms that's being caused by climate change, we can categorize them in three ways. One is psychological, one is psychiatric, and one is psychosocial. So even though at times we use these terms alternatively, but they have distinct meaning. Before we go deeper into this, I'd like to mention that these mental health impacts, they are not homogeneous. It depends on multiple factors, and each individual can have different impact based on other factors. And also there are a regional variation of mental health impacts that can be seen. So what are these? So for psychological outcomes, these are more or less, I'll give you one example. For example, a farmer feeling constant anxiety due to unpredictable weather, but not meeting criteria for a generalized anxiety disorder, that will fall under psychological impact, where it's emotional and cognitive symptom, and it can be subclinical, but it doesn't require medical or psychological treatment. But then again, it can be distressing and impairing. And there are evidence that how psychological outcomes can impact your productivity, as a result income loss, which again can cause further anxiety or emotional numbness. So it becomes like a vicious circle. For psychiatric outcomes, these are mostly individuals with pre-existing mental conditions. These are clinically diagnosed mental disorders and requires medical and psychological treatment. For example, major depressive disorder, MDD, PTSD, bipolar, schizophrenia. But this needs to be assessed by a licensed psychiatrist or clinical psychologist. Then we come to psychosocial impact, which is more prevalent, and this is based on the interaction of psychological and social dimensions. So these include loss of social network or community cohesion. It can be due to displacement. It can be due to loss in asset. Also, solastalgia, that's a concept I'll talk about later in today's class. Family conflict or gender-based violence, loss of cultural identity, and ancestral ties. For these kind of symptoms, clinical treatment is not needed, but social support can be very helpful. Now I will move to different climate events and how what the literature says or existing evidence says and how it impacts your mental health. First, let's talk about extreme heat and humidity. So it's been seen that mental health outcomes like suicide, psychiatric hospital admissions, expressions of anxiety, depression, and acute stress are positively and significantly associated with high temperature, and also the intensity of the temperature as well as the duration of exposure can have some impact on these outcomes. So it's not only how hot the weather gets, but also for how long you've been exposed to that. One nationally representative study in Bangladesh found that heat, humidity are positively and significantly associated with depression and anxiety. It's been also seen that an increase in annual average daily maximum temperatures can seem to worsen childhood mental health. And in terms of, as we talked about a duration of exposure, it was seen that the monthly temperature, if the monthly temperature goes above 30 degrees Celsius, one ongoing exposure to 1 degree over 5 years' time can increase the prevalence of mental health issues by 2%. It's been also seen that 1 degree Celsius rise in temperature, there is a 0.9% rise in mental health related morbidity and 2.2% increase in mental health related mortality. Heat can also impact your sleep patterns. So it's been seen that nighttime heat significantly delays sleep onset and shortens sleep duration, which can ultimately impact your productivity. And it's been seen that it's more profound. The impact is more profound on vulnerable population, that is women, the elderly population, and also people living in the low and middle income countries. There were also some evidence that use of psychotropic drugs is associated with an increased risk of hospital admission for heat-related pathologies during a heat wave period. Because this study says that individuals already using psychotropic drugs are more vulnerable when it comes to changes in heat or excessive heat. Second, I would like to talk about drought and rainfall, which is also a big issue for South Asian countries. However, the existing evidence primarily focuses on rural communities. And as you can imagine, the victims are mostly the farmers when it comes to drought and rainfall. So one longitudinal cohort study found that drought-related stress and psychological distress are present among farmers. And it was also seen that how drought impacts the farmers' mental health conditions are mostly influenced by socio-demographic and community factors, which includes loss of assets. It can be crops or livestock, government compliance pressure, difficulty accessing mental health support, or receiving inappropriate mental health services. So all these different factors can impact the farmer's mental health and influence psychological distress, which is anxiety and depression. One multi-country study looked at rainfall, and it was seen that mood disorders were highly prevalent for countries where there is small variation across month monthly rainfall, or the countries experiencing very high level of rainfall. Next, I'd like to talk about flood and cyclone. As I'm from Bangladesh, it's every 3 months either there is a flood or a cyclone. So one study in Bihar, India, on flood-prone areas found that the elderly populations, like people over 60 years old, had significantly higher level of PTSD, post-traumatic stress disorder, and depression compared to other groups. Common mental health disorders were found to be linked to floods, and these included PTSD, depression, anxiety, and long-term impacts were mostly driven by displacement, financial loss, and ongoing uncertainty due to flood and cyclone. One recent study that took place in Bangladesh in 2022, because during the last few years, Bangladesh has been experiencing flash flood, which was not that prevalent before. It found that around a quarter of the population studied reported a severe level of generalized anxiety disorder. Around a half reported a moderate level of GAD, and another quarter a mild level of GAD. So one thing I'd like to mention that throughout the different climate-related projects that are ongoing under the hub I'm working with, we saw that early warning system plays a big role. So if you are anticipating a climate crisis, you are prepared, and the impact on your mental health is less compared to if it's sudden and you are caught off guarded and not prepared for it, the impact can be larger. Even though early warning system, once you are anticipating it, it itself can increase your anxiety, because it's for a few days you are anticipating the crisis, which can be a flood or cyclone to come. Another study identified that there is a range of risk factors like demographic, which is age, gender, socioeconomic factors, injury or disability. These are the factors that can exacerbate these mental health outcomes. But unfortunately, in most of the South Asian countries, mental health impacts are often overlooked, especially when it comes to disaster response. Now we'll talk about something interesting, which is substance abuse. So you might be wondering how substance abuse is connected with climate change and mental health. Interestingly, in many global studies, it was seen that climate event survivors often self-medicate, and it's been seen that there's an increase in substance misuse, especially for people with pre-existing PTSD and depression. Even though the evidence on such studies is very limited in South Asia, but there are a few I'd like to mention. That one study shows that there is a higher level of alcohol and drug consumption during heat waves when users are most vulnerable. Another study found that there was a decrease in AOD use, but it also found that was due to disruptive services, and for some, it led to unplanned withdrawals. In Bangladesh, there was one study in the hill tracts, and it was seen that climate change was causing a reduction in capacity to practice cultural and livelihood activities. Because in the hill tracts, the livelihood activities are very much environment dependent. So when that changes, it has direct impact on your livelihood activities. But this subsequently results in boredom and loss of identity. As a result, increased AOD, which is alcohol and drug use. Now, I would like you to look at some images and some recent news headlines that capture the impact of climate change. First, this is the McCarthy Glacier from Alaska. The first black and white picture, it's from 100 years ago, and the second one is after 100 years. And as you can see that there is a dramatic change this is a very powerful testimony to the accelerating impact of climate change, how climate change is changing the ecosystem. The second picture is also from Alaska. And as you can see, that was in 1930, and this is in less than 100 years. As you can see, once it was filled with ice, and now it's a vegetated valley, and it has open water, and it has drastically changed the ecosystem in this area. Third is the corals from United Arab Emirates, and this is in 4 years. The first picture is from 2004, and the second one is from 2008, where the coral was harmed with algae blooms. This is known as the red tide and linked with increased greenhouse gas and rising ocean temperature. Now some news headlines, and headlines like this we see very often whenever we open the news portal or newspaper, that animals being extinct due to climate change, fishes are found less. So I think it's not new to us, because it's every once in a while we see news like this. So my question is, how did they make you feel? So you can write it in the chat box. So when you look at the pictures, how does it make you feel? Sad, anxiety, and I'm sure you are not the only person that feels this way. So this brings me to the vicarious impact of climate change. So the feelings you're feeling that can be categorized as ecological grief or ecological anxiety. So what's ecological grief? Ecological grief is the emotional response to the loss of ecosystems, species, or ways of life due to environmental destruction or climate change. So if you are living there, for example, for indigenous communities, those are very close to nature, watching their known landscape disappear can create this grief or anxiety or anger. So that's ecological grief. Then what's ecological anxiety? So it's the chronic fear of environmental doom. So it's mostly seen among people who work with climate change or environment, because constantly you see news or you see data, or you can just experience yourself and observe how drastically things are changing, and it creates this anxiety in you. So now I'll introduce you to an interesting concept that I find very interesting, which is solastalgia. So what's solastalgia? So the way I explain this, as you can see, it's homesickness, even when you are still at home. So how does it work? So I'll give you an example. Suppose you went to your village where you maybe you grew up, you spent time with your grandparents, your parents. It's next to a river. There's a big forest next to it. And you grew up hearing stories about these, the types of fishes your grandparents used to catch, or even you did with your parents. But imagine going there now. It's the same house. Let's say your grandparents and parents are still alive, so the people are still there. The river is still there, but maybe it's not, doesn't look like a river anymore. Maybe it's more like a stream. And the forest is not that dense as it used to be. The fishes that you used to catch, it's not available anymore. So you are exactly at the same place with the same people, but the feeling of home, the definition of home, it's not there anymore. It's absent, which creates a different kind of feeling in you. It can be, how do you define it? It can be grief, it can be anger, and that's what's called solastalgia. So this brings me to two more concepts. One is Anthropocene. So what's Anthropocene? Anthropocene is a term that talks about the period when human activity started dominating the climate and environment. So you can think about the industrial era when we took over the environment and started customizing the environment around us, and things started going wrong, right? So one professor, his name is Glenn Albrecht. He's the one who introduced the idea of solastalgia. Also came up with this concept called symbiosis. So symbiosis is defined as a period where humans symbiotically reintegrate themselves emotionally, psychologically, and technologically into nature and natural system. So imagine us being in sync with the environment around us, with the trees, with the animals, with the insects even. And there was this very big movie based around this concept where you can see that people from one planet was very much in sync with the environment, the trees there, the whole ecosystem. I will keep my eyes on the chat box to see if exactly it's Avatar. So yeah, that's based on the idea of symbiosis. So now let's go to gender-based violence. So as you could see from the very complex map that I showed you before, how gender-based violence can be linked to climate change. So there are multiple evidence that shows that gender-based violence increases during extreme climate events, and it can be linked to PTSD, anxiety, and depression. And unfortunately, women face increased domestic and sexual violence post-disaster, even in shelters and camps. And climate disasters has been termed as a violence multiplier. So how does it work? What are the complex pathways? First, economic hardship and food insecurity. When climate change is causing this, it can have some impact on your mental health. As a result, it can increase domestic violence. So if you are the farmer, let's imagine, and you are going through a hard time, you will have you are having anxiety or stress, you will have sudden outbursts at home. And unfortunately, the woman in the house might be victim to those. But then again, if you think deeply, just because due to climate change, it's impacted your mental health and it resulted in gender-based violence, it is also having some mental health impacts on the victims as well. So it's not a linear relationship. It's more complex than we can think of. Displacement and migration due to climate change can result in similar outcomes. Breakdown of social protection and legal system during climate crisis can also have similar impacts on marginalized groups, for example, rural women, Dalits, indigenous populations, and also underreporting and limited access to support services, which happens during climate crisis, can further exacerbate such outcomes. Since we are talking about climate change and migration for a few times, I would like to focus on that. And first, there's a definition of climate migration. So interestingly, we work with the Lancet Commission with Displacement and Conflict and Health. And we had a long discussion identifying the definition of climate migrants. Unfortunately, there's no proper definition because it very much overlaps with climate environment migration and climate change migration, because it's difficult to identify which is what. And so that's one area we need to work on. And once someone is identified as a climate change migrant, what type of support can they be provided from different organizations and agencies? So as you can see, the migration caused by sudden or gradual environmental changes, it can be temporary or permanent. It can be domestic within a country or across international borders. So the definition can be quite broad. Here you can also see there's this dark humor joke where a family is discussing the floods give us no choice but to leave home. But we thought it should be a family decision whether we migrate to landslides, fires, cyclones, droughts, or extreme temperatures. It might be not as funny for people actually experiencing these. What does the data say? In 2023, it was seen that around 26.4 million people were displaced due to climate-related disasters, which is more than half of all internal displacement. Which is even worrisome, is 75% of forcibly displaced people are residing in countries that are already climate vulnerable. So it's not like they went to a better place. And it's been also seen that extreme heat, cyclones, flooding, and drought threaten livelihood and drive forced displacement through different pathways like increased resource scarcity, flood water insecurity, damage to infrastructure and supply chains, and decreased agricultural yields. This is another interesting data that I would like to share with you, that it's been seen that climate change contributes to violent conflict. And it was found that for every half degree of warming, global warming, we can experience between 10 to 20% increase in the likelihood of armed conflict, which will result in displacement and further migration as well. In my slides, I tried to bring in a few literature on climate change and migration, where they talk about how mental health support is needed at all stages of climate migration. Because if you don't know, according to IOM, the migrants are vulnerable at 3 stages. One is once they decide to migrate, once while they are migrating, and once while they have reached the destination. And at all 3 stages, we have to make sure that there's enough support when it comes to mental health. So what's happening in South Asia? In South Asia, it's been seen the key drivers of migration are sudden shocks, slow onset crisis, also urban pull factors, and also there's systematic gaps, which is weak governance leading to unplanned urbanization. So I'm sure most of us from South Asia will agree that the cities have become a pressure cooker for climate injustice. For example, in Dhaka, in Bangladesh, 500,000 migrants are coming in annually, and they are living in informal settlements in the urban city. Same goes for Mumbai and Delhi in India and Karachi in Pakistan. And multiple studies have seen that in these informal settings, women, they bear triple burden. There is the income loss that they bear, the care work that they have to continue giving, and also the heightened risk of gender-based violence. So as I mentioned, climate change and its impact on mental health, it's not homogeneous. There are certain groups of people that are more prone to the impacts, and the impacts can be more severe for them. So these are the vulnerable and marginalized people. These include children and adolescents because of disrupted development and climate anxiety, women, pregnant women, and postpartum mothers, emergency workers and first responders because of repeated exposure to disasters, homeless individuals, and informal sector workers or day laborers, because they are exposed more to climate events, agricultural workers, the farmers, we have already talked about them, and also indigenous population, as they face most of the time, unfortunately, systematic exclusion from shelters and support systems during crisis. So I have already mentioned them, but just to quickly go through that, what are the contributing factors to these inequalities? One is limited access to mental health services for different groups of people, disproportionate care responsibilities within households and communities. So households and communities needs to be aware of who requires what type of care. There is elevated risk of gender-based violence during displacement and resource scarcity. So we need to be aware of that. And structural exclusion that keeps vulnerable population area from getting enough support. So what can be done to mitigate the population mental health consequences of climate change? So this is the climate change impact on mental health and adaptation response framework from the IPCC sixth assessment report. So as you can see, the risk to mental health and well-being, there are four things that are linked to it. One is the hazard, is the climate hazard. It can be acute events like storms, floods, cyclones, or chronic changes like drought, sea level rise, salinity intrusion. But then there is vulnerability, which depends on whether you have any comorbidity or pre-existing health condition, mental health condition, your age, gender, race, as we discussed about the vulnerable population before. And also exposure. We already discussed whether you are directly exposed to these events, indirectly exposed, or you are experiencing vicarious exposures. So based on all these three, there is the one thing that where we can actually do something, that's the key adaptation response. And the response can be at different levels. It can be at the individual level, community level, and institutional or national level. So let's start with the institutional level. So at the institutional level, state or non-state actors can introduce effective mental health system, planning and preparedness, inform policies, include climate change and mental health components in climate change policies and strategies, as well as disaster response policies. They can also introduce early interventions, and the local governments, they can also facilitate or encourage green infrastructure and also plan and design accordingly. At the community level, we can introduce supportive social networks and also effective information channels so that we are aware that the mental health conditions that I'm experiencing, this is due to climate change. And not to mention at the individual level, we have to be aware, prepared, and if possible, follow nature-based therapy. Because in South Asia, spirituality is a big thing, right? So all these things together can minimize risk to mental health and well-being that is caused due to climate change. But there are some key challenges that we have to keep in mind. One is the idea of mental health. It's very much coming from the North. So the narratives are very much based on the cultures of the North. That needs to be contextualized. For example, if we talk about depression, if I go to a rural village in Bangladesh or maybe India or in Pakistan, and we are talking about, are you depressed? Do you feel depressed? It's not going to make much sense to them. Here I've shared this example of in Urdu, when it comes to anxiety, you say dil ghabrana. In Bangladesh, it's also like some say pet purache ba jane tanche, something like that. So we have to make sure that it's the terminologies that used in like standard screening for mental health conditions are contextualized. Not to mention in South Asia, mental health condition is a stigma itself. We don't want to talk about it. And let alone seeking help for climate, uh, help for mental health conditions. So the cultural stigma around this, we need to fight that, and we need to say that it's okay to feel sad because climate change it's a global thing. It's not only happening to you; it's happening to everyone. And also, we need to identify climate-specific stressors, where, for example, if there's a flood or there's a migration taking place due to it, whatever intervention we design, we have to make sure there is a component that addresses the mental health of those who are being affected. So I am already close to my time limit. So moving forward, in short, what do we do? What can we do? So there are three basic things I would like to mention. One is develop culturally adaptive tools, and it needs to be done in collaboration with local communities so that it's applicable there. We cannot bring some foreign concept and try to implement it. It's not going to work. We have to train community health workers to recognize and contextualize mental health signals, especially that's associated with climate change and climate events. And also, we need to start integrating indigenous knowledge into climate resilient and mental health programs. So those that are participating in these programs can actually connect themselves with the intervention. By that, I would like to thank you all. Look forward to hearing any questions if you have. Thank you.
Thank you so much, Dr. Misha. Was an amazing presentation, very powerful and very important. And as you said, sometimes overlook it, and we really need to have this eyes on the mental health of the population. So thank you so much. I would like to invite our next speaker, Dr. Hashaam Akhtar, who is a global health expert and associate professor at the Health Service Academy in Islamabad, with over 18 years of international experience. His work focused on gender equity, mental health, and climate change, with a strong emphasis on improving healthcare access for marginalized women. He leads initiatives on vaccine hesitancy, health literacy, and climate resilience, integrating gender-sensitive approaches into health policy and system strengthening. Thank you so much, Dr. Hashaam. The floor is yours.
Thank you so much for the very nice introduction, and good morning, good afternoon, and good evening to the participants. Let me start the presentation. Yeah. So you can see the slides.
Yes.
Yeah.
Perfect.
So I am Dr. Hashaam Akhtar, and I work in the Global Health Department at the Health Services Academy in Pakistan. And today I'll be presenting a case study which was done in 2024 in Bahrain, Sawat region. It's a north region, a north part of Pakistan. And we actually got the prevalence of anxiety, depression, and PTSD among the flood-affected population. So the background is about the climate change. It has increased the frequency of extreme weather events, including floods. Northern Pakistan, it's particularly the Swat region, it has witnessed many devastating floods, even cloudbursts, and many other worse part of the weather. These disasters not only cause physical destruction, but also they have a severe psychosocial or psychological impacts. The flash floods of 2019 and 2022, it affected around 90,000 people in Pakistan. in 2000, in September 2020, 2000 to 2022, it has been claimed that 1 million people were affected from the floods and droughts. And this has also affected in around 2018 and 19 about to 7 million people. 40 million people were displaced from their homes, and around 4 million acre crops land destroyed due to floods. So this is all recently happening in Southeast Asia, including Pakistan. And as Dr. Farzana has already mentioned, that this has a direct impact on the population, and including the farmers, the lower economical status people in these countries. So we did a research, and the objectives were to assess the severity, depression, anxiety, stress among the flood affected individuals, to examine the impact of anxiety on mental well-being, identify demographic factors associated with psychosocial stress, distress, and most importantly, to explore the policy implications for mental health interventions. Um, it was a cross-sectional study at the Bahrain region in Pakistan, which included around 388 participants. We had a structured questionnaire and face-to-face interviews with the participants, and the tools they were using were the Depression Anxiety Stress 21 tool, GAD-7, and PHQ-9. And the study was done in 2024. And this picture is actually this is a daily routine life of these people. They are transferring some food items to their home, and this is like they're doing it every day, like maybe 2-3 times or more than that. And even the children, they go to school through this so-called bridge, the sliding bridge. And this is what is happening every day there. So in our study, we had around 388 participants. Most of them were males. Reaching to females is a bit difficult there, and as Dr. Fazana has shown that there is a lot of burden on the females. The other side is like reaching them and asking them questions is also a very challenging part of the research. Um, and and um, and there are many other hidden factors behind those hidden questions. So the majority of the participants, they were males. 74% were married, and the education level were low, with around 42% of the participants, they were not educated. The majority, around 54%, were from middle economical status, while 42% were from the low economical status. We got other information about either they were living alone or they were living with the family, which economical status they belong, what occupation do they have, and as you can see that around 7% were jobless and 13.7% were students. So 20% they were totally dependent on their families, and other demographic what to call that findings were about the most of the individuals, around 56.4%, they get the recommended 7 to 9 hours sleep, but most of them, like 21%, they were getting less than 6 hours of sleep. um, they had many chronic diseases reported, like which are after the flood very common, like the gastrointestinal disorders or many other diseases. But these findings are just on the questionnaire. We were not there to get the exact percentage, and many were not aware of their own health. Um, so the factors associated with the depression, anxiety, and stress, according to the scales, they were very much interesting. The marital status significantly impacts the depression and anxiety scores. So if you have someone to discuss your to tell your heart out, then you can you can lower the rates of anxiety and stress. So the singles were having more stress and than the married ones. Divorced or widow individuals were notably at higher compared to the married ones, and the relationship between marital status and stress disorder is not statistically significant. For the economical status, the people which belong to the upper class, they showed high scores compared to the middle and lower income class. Economical status does not have a significant effect on the anxiety. There were like many differences between the findings in the stress and anxiety, and we were also trying to go towards the eco anxiety also. The other part of the study is about the eco anxiety, where we use the climate anxiety questionnaire and the eco anxiety scales, and we got the emotional responses from them, like either they were feeling helpless, or they were feeling sad, or they were feeling anxious, or they were afraid of having something similar in near future. So the study has a few elements that we were discussing in the whole procedures. And however the living arrangement of the participant, it does not have significant impact on the anxiety. For the daily exercise, this was also a challenging question to ask them for the exercise. It's a hilly area, and people go here and there on the mountains everywhere. Like and most of them were replying that we do not need any exercise for the daily routine. But exercise, it doesn't have a significant impact. That's the reason that I think it's behind this findings. And uh, education was the last thing that we were looking for, and education level significantly impact the stress scores, with the lower education level associated with the higher stress. However, the effect of education on depression, anxiety scores were not statistically significant. The key finding for the whole study was that the depression was around 74.5% from moderate to extremely severe. The anxiety was around 93.6% moderate to severe, and the stress was 72%, varying different levels. And this is an actual picture from the region of Bahrain region of Sawat, where females, they had to cover their body to come out of from their houses. So it's a very difficult situation for the female and for the researcher like us to reach them also. So the key findings, again, factors such as age, marital status, economical status, living arrangements, and education have significant association with one or more of the DAS21 subscale, indicating that these factors may play important role in influencing mental health outcomes. So these findings do have a role, and I'll show you in the next slides. The analysis highlights the complexity of how different demographic and lifestyle factors interact with mental health, with some factors showing stronger association with specific aspects of mental health. Higher levels of distress were associated with older age people, economical unstable people, and living alone, whoever was living alone. Um, this is the last objective that we're working on, and it was for the policy implications and recommendations. So we found out that integrating mental health into to disaster recovery plans is very important. We need to have community level resilience programs. We need to have early warning systems for the psychosocial risk, and mental health awareness and support services. So these are the population which are directly affected by the climate change, and these as Dr. Farzana also said, that early warning systems, they do have a role. If you know if something is going to happen and you just get prepared for it, this is always helpful. The conclusion is the climate related disasters significantly impact mental health. Targeted mental health interventions are necessary for disaster recovery. Policies should be incorporated behavioral sciences should incorporate behavioral sciences to enhance the climate resilience, and collaborative efforts are required to mitigate long-term psychological effect. Um, this was the team that were working with me and institutions that were involved in the study. Uh, one last thing that I need to say here, that we had a collaboration with Dr. Mia Nizam, who was working in Bahrain since last 15 years. He has a lot of experience working with the psychological wards in Bahrain, and he also had experience with the volunteer working as a volunteer in Bahrain. So, as the graph says, that there were less than 40 patients every day in his OPD since till 2020. And after 2020, this graph has a drastic increase, and it reaches to around 100 to 150 patients per day, which can be a positive thing, and it can be a negative thing. Like, there are many patients coming, or there are many people coming with awareness about the mental health. This is the topic that we are still looking to find the answer, and do some research on these findings. Thank you so much for the time.
Thank you so much, Dr. Hashaam. Was amazing, and I think it showed how Dr. Misha was saying to us that any actions need to be contextualized to cultural, socioeconomic, and local aspect. And I think your research showed how how people feel differently, all the mental health impact. And I'm going to call our next speaker, Dr. Maria Tika Kartika is a physician and global health practitioner from Indonesia, currently completing her Master of Medical Science in Global Health Delivery at Harvard Medical School, with a background in health systems, planetary health, and community-based research. She has worked with NGOs and think tanks to strengthen primary care, maternal health, and climate-resilient health system across Southeast Asia. Thank you so much, Maria, and the floor is yours.
All right. Hello, everyone. Good morning, good afternoon, and good evening. I'm Tika. Let me just starting by sharing my screen. Okay. Can you all see my screen?
Yes, yes.
Okay, so as the last person of today's session, I just want trying to recap all the information and the valuable courses that has been given by Dr. Farzana, and about what is actually can we do in terms of very practical and very pragmatic way about the correlation between the climate and mental health. So I'm just gonna start with the ASRI. So ASRI is Alam Sehat Lestari. It's a planetary health initiative in Indonesia. So where is ASRI is located? So ASRI is located in the West Kalimantan or West Borneo. So ASRI is here in the small part of West Borneo, and it's surrounding by the national park and also other parts of the social forest that owned by the community, and also a long of peatlands areas in West Borneo. And then what do we do? So what do we do is actually combination between the livelihood, reforestation, and also the health. So there we have like a small clinic, like a beautiful clinic to serve the local people and especially the indigenous communities there, which is a Dayaknis. So this is a beautiful picture of Pak Iskandar and his family, that Pak Iskandar is one of our forest guardian that already been contributed for the reforestation in West Borneo. And then I will start by putting this into like a chronic disaster that always happen in West Borneo, which is forest fires. So this is like the satellite picture from NASA in 1997, which is very striking me because you can see here, this is like the biggest forest fires in Indonesia up until now was in 1997. And you can see here like the effect about the forest fires, like we can mention about the air pollutions especially, is actually transnational. So here, like you can see, even like the forest fire back then was also in South India or like in some part of East African countries. So this is like the program that we had before with our second president about the estate, and mostly about the forest fire in Indonesia. It's mostly a human triggered, but it's also worsened by the drought and especially during the El Nino season during May until October every year. So what happened now? So Kalimantan or Borneo is a landscape that is a very fire prone for the forest fire here. So this is like the data, like the latest is from 2015. It's a bit long time ago, but it's still like relatable that every year that we can see here, that every year the hotspots for the forest fire keeps increasing. And up until now, like the hotspot for the forest fire itself that caused by the human triggered, it's also keep worsening as well, because the human triggered is mostly by doing some slash and burn practicing, and also from the extractive industries or the extractive practices for coal mining, for timber, for nickel and gold mining. So like the land clearing is one of the big cause for the forest fire in Indonesia. And we can see here like Kalimantan and Sumatra have always been the major hotspot for the forest fires. And to put as the contextually, Indonesia 52% of the area are covered by the primary forest just behind Brazil and the RC in Africa, and also mostly of the on the structure of the forest is around 11 or 15% is a peatland, which is very hard to get mitigated, and especially during the drought or El Nino season when it comes to fires, because it's a highly flammable areas. So this is like a very interesting pictures from this article in the Strait about the Singapore itself, because the forest fire that happened in Indonesia started already a way long time before that. So the first time recorded was in 1972. That is very well documented. And this is like Singapore in 1972 when Kalimantan and Sumatra had the forest fire. And this cycle keeps happening almost every year or like almost every 2 years. And this is the last recorded picture in Singapore in 2015. So this is like the afternoon or like the evening time in Singapore, and it's already like the sky turned into a dark orange, like a bloody orange, even in the afternoon. So I just want to show you the picture. I was honored because I was there in ASRI as the medical director and also practicing as a clinician there, and I was there since 2019 and 2023, and personally, I've been like through all the three biggest forest fires in my life before. And to put it note that I was born and raised not from Kalimantan. I come from other island in Java. So when I start practicing as a clinician in Borneo, I didn't know at all about the risk, about the climate risk in the place that I work for. So in 2019, so this is like the picture that was taken by my good colleague here, that this is like the area or like the garden just behind our clinic in 2019, and this is where the forest fire happened in 2019. And you can see here, like I still remember that this picture was taken, I think like around at noon, so it's already like very polluted by the smoke, and we couldn't see anything actually, and also we couldn't breathe at all. And I was also there in 2020 and 2023. And this is like the picture that was taken by the Jakarta Post about the situation in Pontianak, which is Pontianak is just like 3 hours away from the place that we work. And yeah, again, like the sky just turned into like a dark, bloody orange, even though that this is already like, this is like, that was at 1 p.m. or like 2 p.m. So it's supposed to be like very clear, like very blue, but during the forest fire, no at all. And then I still remember during every year, me and my colleague, it was like so devastating, even like for myself, because I remember that every day I had to wear the N95 mask. It's a medical grade for filter out the 95% of airborne and especially for smoke and viruses, even when we slept. So every day when there's like a fire, so every day when there's a forest fire happen, we always sleep with the N95 mask. So this is not actually impacted the physical health. There's like a spike cases with the respiratory problems, asthma, and everything. But deep down, there's like also the mental health impacts that we just discussed before about either psychological and psychosocial mostly. So I cannot imagine that myself and also like other people in that area and also the local community especially, it was like so hot, even like inside the house. And in that area, the electricity capacity is very low. So we couldn't install the air conditioner. So we just rely on the solar panel or the generator, which we couldn't install any aircon. So you can imagine that outside the house, it was like very smoky, it was hot. But inside the house, it's also hot, it was also humid, but it's also still smoke everywhere. And even like during we sleep, we eat, even like we take a shower, we still need to wear the N95 mask because it's like the feeling when the community feel like, oh, okay, like this is happening every year. This is like a chronic condition that always happening, keeps happening every year. And this point was actually the most prominent feeling that we got from the patient and also from the community during the forest fires. The most prominent one is about the anger, it's about the powerlessness, about the helplessness, and also about the frustration. Because this issues keeps happening every year, but there's a nothing significant change about how we can mitigate about this and how we can actually adapt for this. So there's like two excerpts here for from the mother of three and also from a man that worked as a farmer there. Let me just read this for you. One of the mothers say that you cannot sleep, you cannot breathe, and there's no one to call. We taught to be strong, but even the strong get tired. I'm not sure how much more we can take. And also, one of the committee members say that he's the farmer. I couldn't protect my corpse. I couldn't protect my children from the smoke. I just sat there watching everything that I built burn. You feel like a man should do something, but what? When there's a fire bigger than all of us. So there's like the prominence of the frustration and the helplessness that we can see, like the hint also with the anxiety and ecological grief that we can see from the community that we've been talking with. So this is like a massive underground and also undetected at that moment about what actually the community feels about the forest fire that always keeps happening. And oh, sorry. Yeah. And then if we can remember here that in 2020, the pandemic, of course, made it worse. So we call it like the double trouble about the fires and about the smoke. So there's like a lot of massive issues back in Indonesia, and especially around Sumatra and Kalimantan, how we can actually strengthening our primary health care to be able to combat with a COVID, but also with all the problem that caused by the forest fires. So this is also like one of the excerpts from the women. Let me just read it for you. We didn't know what would kill us first, the virus, the smoke, or the silence. People were coughing, struggling to breathe, but too afraid to leave their homes. Even when the air burned our lungs, we stayed. Because where would we go? So, talking about the displacement and migration, for those who can be able to afford it, they have like another opportunity to maybe move out to that place and to seek for another life in other places. But in this area is practically they're a very remote, they're indigenous population. They are spiritually and physically tied to the land that they were born. So it's kind of hard to also ask them to move because there's nowhere that they can go, and also their spiritual beliefs and traditional beliefs is very highly tied into the land and also the forest that they live. So the pandemic, like you can imagine, in 2020 we were like very struggling how to provide with the services for both about the forest fires and about the COVID. So when people said like, okay, Tika, why you can just refer the patient to the psychologist or the psychiatrist in the city. But in my personal experience, when serving this indigenous population, or also, I think like I also believe anywhere, the accessibility is uh, is the one. Like in here, like in the first picture here, this is like the picture that I took, where we had to go from the clinic to the nearest city, and we had to pass through all the muddy, all the rocky road, and also yeah, like we have to pass it through the palm oil plantation. So there's no electricity, there's a bad road, and it takes us like around 7 to 8 hours by car to go to the city to access the psychologist or the psychiatrist. And even in some villages, they have to take the like a small wooden boat like this to be able to access to the psychologist or psychiatrist in the nearest hospital. And it takes them like also like the same 8 to 7 hours by boat. And this is also one of the picture that I took when I rode by myself with the motorcycle. With that, we have to pass like all the hilly and mountainous areas to get to through the nearest support for the mental health. So back then, when I was as a clinician in the place, and then when I also has the the experience about the mental health, we were just like thinking what we can do actually for this community. And the very first approach that we did is actually by doing the radical listening. So what is actually radical listening means? So listen and listen to the community, and we call it like a radical because we just dare to sit with them and to listen what they actually want to say. We just came up with the very simple questions. Um, the first one is, how do you feel about this? And the second one is what we can do after this. Because we want, because we are aware to capture that they're indigenous population, they have like a very strong bond with their land, they have their knowledge and practices. So we just want to gather what we can do and how do they feel. So the excerpts that I just show you is actually the excerpts that we taken from the radical listening that been taken throughout leave from 2019 until 2023, and up until now we already conducted like around 300-ish for the radical listening in every villages, in every communities that we serve. So we not only radical listening to the man here in the left, like this is me and my colleague, but we also listen to the mother and also to the elderly, that because we aware that they are the most vulnerable populations that got impacted the most by the forest fires. So we just try be there to listen what is actually the inspiring or like the aspiring advices or suggestion that we can do as the community to build the resilience among them. And based on the radical listening that we got, we actually decided, oh, okay, let's try to make it real for something that is helpful for the community that we serve. By the first thing that we did is we do the regular training sessions for the healthcare workers about the mental health services and the delivery, because we are aware that there's none of the psychiatrists in town or even like the psychologists in town. So we have to be standing on ourselves to be able to serve. Oh, okay, like we have to equip ourselves with the knowledge to serve to the community. And then the second one is we built the community-based mental health. So this is me and my colleague. This is when we conducted the first training. So those beautiful ladies and men here are actually the local people that volunteer at first to help like the peer support for the mental health during the forest fires, because the anxiety is there. During May until October, we never know where or when the forest fire will coming up, because the hotspots are too many, and there's like always a possibility to get the forest fire everywhere. So like we have to be able to support one to another, and that's the way that we first conducted the community-based mental.
Maria, I will ask you to conclude as soon as possible because we are already ahead. Thank you.
Okay. And then we also realized that the health is not the only one, but we also need to make a cross intersectional with the forest guardian. So we have also like all the mans here are the forest guardian that help us with the forest fire mitigation and early warning system for rewetting and for the revegetation. And of course, the education and community outreach is important, and especially advocacy to the local government. And what we can learn from the pilot. The first one is the community has to identify the needs, and especially if we work for the indigenous population, because the community solutions have a huge impact, because they have the sense of ownership that, okay, like this program coming from ours. And people will get involved, like the picture that I show you with the forest guardians and also with the community-based mental health, because that's the design that we designed together with the community. And the solutions are intersectional because we need to include the access for the healthcare, conservation support, and also the education to tackle this. And then it needs, of course, the monitoring and evaluation systems. The last slide, what we can do as the healthcare workers and practically. I think like the first one is we have to learn about the land and the people that we work for. Like me, I was born in Java, but I start to learn about the forest fires when I served the community in Kalimantan. And then the second one is about a listen about everything that pops up during the community outreach, or even just like the casual history taking to the patient. And then connects the patient to the psychosocial support anywhere or something that you can make with the community resilient based, and then also bridge the gap between the system and the people. Also trying to engage in local and systemic solutions, because as healthcare workers, we have to speak up as a frontliners about what is actually happening in the community, and we have to engage with the systemic solutions, even though that maybe it's intersectional. So, and the last point is about to care to ourselves too, because I couldn't imagine myself to still serve to the people back then if I wasn't taking of myself during the forest fires. So thank you very much. Thank you so much. Please do connect. And then if anyone is interested about the other movement that we have in Indonesia, you can actually connect to Alam Sehat Lestari or ASRI, or also in Health in Harmony for other movement in Panama, Madagascar, and India. So thank you very much, everyone. Let me just stop.
Thank you so much. Thank you so much, Maria, for this very interesting presentation. I would like to invite all the speakers for our last panel. We don't have enough time to respond all the questions, but looking at all the questions, I could see that people are asking regarding what they can do as a health professional, as a first responders, how they can be prepared and how they can build resilience in the community. So I think this is a question that all of you can respond, and maybe we can start with Dr. Hashaam. And they also ask about low-cost action. Maria can also bring some actions that were developed after this whole experience with the community. So the question is what they could do to prepare themselves, and also how they can work with the community to build resilience. Who wants to go first?
Yep. So it's a very relevant question, and I assume that most of the participants, they are the youth, and they are they can be much utilized for these the reasons. And maybe if they can plan some camps with some gender-wise distribution or age-wise distribution, like I've seen many people working with these flood affectees or the drought affectees, with the children or the females or the young males, and carrying out different exercises or productive workshops. And this can enhance the mental situation of those patients or those participants. Early warning is also one thing, that if you can see something is coming and you can plan something before time, and you can go to those areas and work with those affected people. This can also be useful, and all of this it should be part of the policy making. This should come from the up side of the governance, and I hope that this will be part of most of the interventions in future, that we are looking these disasters every second month now.
Thank you. So I heard education program and information to the community, and make sure that if it's possible to have information ahead of time so people can be prepared and better understand the risk. So what else that maybe Maria and Farzana want to complement?
Oh, okay. I can go. I think like to chime into the early warning system, I think that is also very important, how to mitigate. And also because I work mostly with the indigenous population, so like the knowledge about the traditional practices is also something that important that we have to do, because we don't want to detach them with the spiritual beliefs and practices that they've been practicing for the long period of time. So I think like answering about the low cost, I think like the low cost that that we can practice is actually by just the approach that I mentioned is about the radical listening, because that's actually the first starting point that we can start from there, about what is actually the solution that coming from the community about the mental health, and also about how to prevent the climate change based on their traditional beliefs and practices. So I think that's something that we can do in a more practical way. But I think it needs like also supported by the research and also the advocacy and also the education in general.
Great. Do you want to add anything, Farzana? Or
No, I would just like to say that I agree with both of them. And from the projects that we have conducted at our school, we most of the cases we found the same thing, that the low cost interventions, it comes from those local people. Because I can come up with some great innovation and try to implement it here, but if they are not being able to connect to it or understand it, and my understanding, if I'm not from that community, can be very different from reality. So and there's the IPCC and all the global bodies on climate change, they are putting like a lot of emphasis on locally led adaptation strategies, and that's one of the reasons why. So I would just agree with what Hashaam and Maria said.
Thank you so much. So I'm going to finish this session, and I'm going to add just a little another suggestion on this, that also health professionals can engage into some institution that brings support during disasters, and for example, religion institutions, NGOs. And as you already have this knowledge that mental health can be impacted, you can also educate the people who is giving support on how they can proceed and how they can manage that situation, so people can receive a better treatment and be listened, as Maria brought to us. So I'm going to finish. I would like to thank you all the presenters here and all the audience, and I would like to invite you to our post-session survey. So please evaluate our session, and we see you in our next meeting. And if you are not part of our WhatsApp group, please join us, and you will receive closer information about the course and the next sessions. Thank you so much.
Thank you. Bye-bye.
Thank you.
Thank you so much. Bye.